I'm delighted that your colleague and my colleague, Professor Matthew Bennett, is next in line to speak. And as Sue said, he's a co-investigator at the Circle Centre. So Matt, please.
Many thanks, Alan, and many thanks, Sue. I think there's a great contextualisation of adult social care at the outset from Alan. Particularly thinking about his comments on sort of care happening in the community, and I think that this is, this now, the work that I'm going to be sharing sort of demonstrates the impact of those people in the community, unpaid carers who are providing so much support for loved ones and some of the most vulnerable people in our society, but also the contextualisation and the recommendations outlined by Sue. I think it's when we have that contextualisation of the system and what recommendations can be made and what needs to urgently be made for urgent reform, it helps us to understand some of the findings that I'm going to be sharing with you now. So I've been working for a few years now with Sue in Circle and on sustainable care research, and I've been mainly focusing on the costs and consequences of unpaid care for those people who provide it, particularly thinking about financial costs and consequences, health outcomes, and social relationships and social isolation and loneliness in particular. What do we mean when we think about unpaid carers? Well, we're typically looking at people who look after and give any support to anyone because they have long-term physical or mental health conditions or illnesses or problems related to old age. I think as well, one of the things I wanted to highlight as part of this ongoing work is the relationships that we have with people in the sector and charities and stakeholders, really co-producing research to help us understand the inequalities of care and to help us make informed evidence-based decisions on how we might go about supporting unpaid carers. So just wanted to reflect really on some of the work that we've been doing with Carers UK in partnership with the Sustainable Care programme. We know from the broader academic literature that there are huge inequalities and that carers suffer as a result of the care and the support that they provide, and that there are massive gender inequalities too. So in a report that we published in 2019 with Carers UK, we basically looked at the social profile of carers and who was more likely to care and what this meant at different stages of your life course. And we found that 65% of us will provide care at some point in our lifetime, and that's a higher likelihood of owning your own home. Women are more likely to care than men are, and they are more likely to provide the highest intensity of care too. Women become carers 11 years earlier than men do, and we also know that there are huge health inequalities as a result of being an unpaid carer as well, and also significant financial implications in terms of labour market participation, pension contributions, assets and savings, etc. So in the context of these inequalities, at the outset of the pandemic, as a group, we were really interested in looking to see what the impact of the pandemic was having on unpaid carers. We have a number of reports that you can find on our website which describe this research in a bit more detail. So I was really interested in mental well-being of unpaid carers, also hunger and food bank use, and also social isolation or loneliness as well. So just thinking through some of these findings just more broadly, we found that carers' mental well-being was lower than non-carers. We found that females had much lower levels of mental well-being than male carers. And that it was also lower for working age carers, especially those in the 17 to 45 year category. We also find that there were significant declines over time. So carers experienced the strongest decline in their mental well-being just before the pandemic and going into that the first few months of the pandemic. And females experienced the biggest decline in their mental well-being too. Older carers also suffered a decline in their mental well-being, and it also declined for carers in employment and carers with without a paid job too. In terms of hunger, we found that 3.5% of carers said that someone in their household had gone hungry in the previous week, and this amounted to approximately 228,000 carers across the UK. The females were more likely to report this than males, and also younger carers experienced greater levels of hunger compared to older age groups. Quite shockingly, carers were twice as likely to report using food banks in that first in the first few months of the pandemic as well. Just over 100,000 households with carers in it had used the food bank in the previous 4 weeks, and again more likely to be women compared to men, but also 8% of carers, or younger carers aged between 17 and 30, were more likely to rely on a food bank as well. In terms of loneliness, we found that about 30% of carers reported being lonely in the past 4 weeks. 1 in 3 women who were carers reported this versus 1 in 4 males. So again, a strong gender gradient there. Carers in younger age groups were more likely to experience feeling lonely, and also working carers as well. And so I think it's important that we found that a number of these inequalities had been exacerbated as a result of the pandemic. That a number of these inequalities that are well documented in the literature just widened. So, one of the things that I think is really important to stress, and that Sue has already discussed, was that there were already inequalities and failings before the pandemic. They've just been exacerbated now, and they've raised the profile of care and unpaid carers too. So women were more likely affected, across these well-being measures. So I think it's important as a society, and particularly at local levels, how we think about how we support unpaid carers. So thinking short term of ways that we can end carers' financial hardship, ensuring that systems are in place so that carers can access food, and that there's increased investment in their mental health and well-being support for carers. Making sure that services and the provision of services are better supported and reinstated, particularly things like respite care. And in the long term, really thinking about how we increase recognition and identification of unpaid carers, and the financial, making sure that they get the financial support that they need. Making sure that social care is a priority for funding, that it's receives parity with the NHS, improving carers' rights in terms of things like being able to make them better be able to juggle their work and their caring responsibilities. And really just making sure that the needs of carers and those they support are fully considered throughout throughout our recovery plans and moving forward. So those are the main topics and issues that I wanted to discuss, really focusing on some of the empirical work that we've been doing as a group. I think shortly we're going to have an opportunity to discuss what these might look like in a bit more detail. So thanks very much, Alan.